United States, the American Cancer Society expects about 300,000 new prostate cancer cases and 35,000 deaths this year alone.
But what are the risks and who should test and when? Joining us today is Dr. Robert Princenthal. He's the medical director, prostate MRI at RadNet, with some answers, as well as a prostate cancer survivor, Paul Colacchio. Thanks for both of you coming in today.
Yeah, good to see you.
Well, thank you for highlighting September's Prostate Cancer Awareness Month. As you just mentioned, prostate cancer is one of the most common cancers in men. And the biggest problem is men tend to be scared of getting screened.
So when do they start?
Screening should start at 50 for most men at normal risk factors, and it involves a simple blood test of PSA. And if the PSA is elevated, they should ask their doctor for a prostate MR. Because with MR and PSA together, we can identify which men may have cancer and would benefit from a biopsy. And also importantly, we can avoid men from getting an unnecessary benign biopsy.
So it should just be a part of your yearly checkup.
Yes, exactly. And most men are just reluctant. They don't want to talk about it. And they think the side effects of treatment are worse than the disease itself. But no one should die of prostate cancer if caught early.
It's interesting because you mentioned during the commercial break that it is similar to women getting the mammogram, men need to get the prostate. So I think that's a great point to make. Also, what can men do to lower their chances and the risk?
Well, the easiest thing is just to get screened, because risk modification is hard. It's basically a healthy lifestyle, you know, weight control, exercise, appropriate food intake, and monitoring their testosterone level. But other than that, the best thing is to get tested and screened.
Okay, so just recently, UCLA researchers found that an ultrasound with high-frequency sound waves can actually heat up and kill cancer cells. What's your opinion of that new approach?
I think there are a lot of different ways of diagnosing and treating prostate cancer, and everybody knows their uncle who's had horrible side effects following surgery of what we talk about, impotence and incontinence. But there are newer treatments available, including TULSA, which is HIFU, and yes, for certain men it's very effective and it has lower side effects. And again, if you have cancer, there are many treatment options available that will allow you to maintain all of your functions.
Paul, let's talk about you for a second here. You were telling us you were diagnosed at 54.
Yes. I started urinating a lot at night while I was sleeping, and when I was sleeping, and it got to be about 8 or 9 times a night. So I went to my doctor, and he said, well, you know what, let's do an MRI and see what we see. And I had the MRI, and it showed something. I had the biopsy, and it was determined that it was prostate cancer. The TULSA method came out the year after I had my surgery, so I had to have a traditional prostatectomy. So they removed it completely, and I'm very lucky so far that I'm really not experiencing too many of the side effects. So I hope it stays that way.
Right.
So you feel like life is pretty much today like it was before?
It is. I'm just more aware of my body, and that I really should screen. If I feel something, you know, I'll call my doctor, make an appointment, and I'll just say, you know, this isn't right, that isn't right. And I'm more conscientious now about my health.
I feel like also, too, that you shared with us that you really want men not to be, and you know, you guys said babies, but like, don't be afraid to go to the doctor.
I don't know what we need to do for men to understand that if they catch it early, they will be fine. And there are treatments now where they don't even have to have surgery. They can just go in, have this TULSA method, and then be on their way. It's simple. It's very easy, and I don't know why men will not pay attention. Women do it every year. It's part of their life. Well, we have to do the same thing.
Well, thank you for coming in and giving us the pertinent information, Doctor.
Thank you so much for emphasizing Prostate Cancer Awareness Month.
Yeah.
All right.
Appreciate it.
All right, you could learn more about Dr. Princenthal and RadNet at radnetimaging.com.
All right, have a beautiful day, guys.
Thank you
so much.
Thanks.